In today's Health Alert, country singer Toby Keith passed away on Monday after battling stomach cancer. His death has brought awareness to a disease that claims nearly 11,000 American lives annually. Doctors caution that symptoms are easy to overlook, a concern shared with our chief health editor, Dr. Partha Nandi, who joins us today. Doc, this is kind of your wheelhouse, I know. Tell us about this cancer.
Yeah, first of all, I'm very saddened to hear, the passing of country music legend Toby Keith. He was a super talented performer. We all know that. 20 #1 songs and will be greatly missed. Now, stomach cancer, we're talking about that. It's also called gastric cancer. Several types. They're multiple, and I've seen them all in my practice, unfortunately. Now, the most common type is called adenocarcinoma. It starts when cancer forms in the lining of the stomach. And if it's found early, there's a better chance of recovery. Here's the problem, that stomach cancer usually doesn't have symptoms early on, but if they do, they're easily dismissed because they seem to be innocuous symptoms like, hey, I've got indigestion, stomach discomfort, heartburn, mild nausea, loss of appetite, feeling bloated after eating. And as the cancer progresses, it can spread to other parts of the body, including the stomach wall, the body of the stomach, or lymph nodes. More symptoms can appear like blood in the stool, vomiting, abdominal pain, even difficulty swallowing. Sometimes you can get jaundice, unexplained weight loss, and fluid buildup even in the stomach. So lots of things. So
Toby Keith, he lived about 2 years after the diagnosis. What is the prognosis for this cancer, and is this a type of cancer that can be prevented?
First of all, Toby Keith was, passed away at age 62, as you mentioned, and that's considered relatively young. The average age, Brian, when people are diagnosed with stomach cancer is age 68. Men have a slightly increased risk compared to women, about 1 in 101 versus 1 in 155. What about prognosis? Now, that depends on the stage of the cancer, whether it's spread and a person's overall health. Now, the 5-year survival rate is 75% if the cancer is only in the stomach, but drops to 35%, big drop, if the cancer is spread. And there's treatment, as Toby Keith mentioned. He had received chemotherapy, radiation, and surgery. However, there are several treatments and decisions will be based on the stage of the cancer and how the patient's doing. Regarding prevention, now, we're uncertain still about why cancer cells are, start growing in the stomach. There are some factors, however. An infection with a common bacteria, H. pylori, can be involved. Inflammation in the gut, stomach polyps, and a specific type of persistent anemia called pernicious anemia can increase your risk. To lower your risk, here's what you do. If you have that stomach infection, treat it with antibiotics. Also get plenty of fruits and veggies. It's important. Cut back and avoid salty and smoked foods. Limit your alcohol intake and don't smoke. If you have symptoms that you're worried about, please discuss them with your healthcare provider, because the earlier we get this, diagnosed, or the better the treatment is. Again, we don't want to panic people. If you have indigestion, you have stomach cancer, it's not that. But if you have persistent symptoms, talk to your doctor.
And the sooner that you can start tackling it, the better off you're going to be, the easier it is to prevent.
I've seen people be cured from it if they're treated early. So it's possible, but we can't just let it go, and then if it becomes too late, then you can't do much about it.
Dr. Nandi, grateful as always for your expertise.
My pleasure.
Thank you.
Of course.
If you have a health question for the doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or Twitter.